Our next speaker is someone who, at an age when her peers were in school, she was traveling the country as the drummer in a punk rock band. When others her age were launching careers and starting families, she was confronting a life-threatening illness. The creativity and curiosity that she brought to that illness put her at the forefront of a social movement that makes patients partners in their own treatment. Please welcome Liz Salmi.
Okay, everybody, it is time to fess up. Raise your hand if you ever turned to the internet to research information about your own health. Yes, my kind of people. Well, congratulations, because you're engaged patients. Your internet search is not surprising. In fact, we know that out of the 40,000 Google searches happening every second, 2,000 of those searches are health-related. I am not a clinician, and I'm not an academic, but I am a patient. And so for the last 10 years, I've had a front row seat to the changing nature of patient access to information. Over the last 10 to 12 years, so much has changed about how we communicate with the world and with each other. Even how we talk about our health has changed. But what hasn't changed so much is how much information clinicians and health systems share with patients. So for the next few minutes, I'm going to share with you a bit about my life as a person living with a serious diagnosis and how I've come to embrace and advocate for more transparency and openness in healthcare. And then I want to shine a light on how increasing patient access to our medical records is going to be a game changer in improving quality and outcomes and safety in the patient's own care. But first, you need context. So here's my patient story. In 2005, at age 25, I picked Kaiser Permanente for my health plan for one really important reason. I liked their website. According to this website, I could pick a doctor, email that doctor, make appointments, and order prescription refills all online. And as a healthy young person, this was really important to me because it meant I did not need to talk to anyone. Fast forward to 3 years later. In July 2008, 1 week after my 29th birthday, I suffered a massive seizure. I landed in the ER, and scans showed I had a mass in my brain. And then, after a 9-hour surgery, I learned I have an astrocytoma, which is a slow-growing but malignant brain tumor, and it has a high rate of recurrence. 6 months later, that tumor grew back, and it sent me into a whirlwind of treatments over the next 2 years, including a second brain surgery, relearning how to walk and balance, and then 24 months of chemotherapy. There's no right way to respond to a cancer diagnosis. But my way was to first respond with fear, but then respond with curiosity. And because I have a digital communications background, my instinctual response was to start blogging about this experience and telling everybody, my family and friends, about what was going on with me. And for some reason, over the following weeks and then months, and now years, this blog gets an average of about 30,000 visits each year. Throughout treatment and beyond, Kaiser's online patient portal became a major part of my care. I loved this thing. After every appointment or test, I would faithfully log into that portal and stare at the lab results and metrics and graphs that were depicting various details about what was going on in my body. And if there was a word or a phrase I didn't know, well, I'd go online and look it up. And if I couldn't find what I was looking for, I would use that same portal to send an email to my doctor to ask a question. Because what use is this information without interpretation. So over the last few years, things have been going well with me. Spoiler alert, I am still alive. But early last year, something changed. In July 2017, my husband, Brett, was offered a great new job. But this new job did not give us a chance to stick with Kaiser for our health plan. We were scared, and we were nervous. But I was also completely confident in my ability to transfer my medical records and pick a whole new care team. I had no idea that a simple request for my medical records was going to forever change the way I view having access to my health information. Now, you all know we have this legal right to request and receive and see a copy of our records. But I can tell you that this process takes time and effort, and sometimes costs are involved. Had I asked for a paper copy of my record, it would have cost 15 cents per page. Or in my case, $725.85. Of course, I went with a digital copy of my records on three DVDs for $45. But because I spent money on it, I was really curious. What did I just pay for? So I stuck one of those discs into the computer, and I found a 4,839-page PDF file that was my medical record for the previous 8 years of living with a brain tumor. What could be so large? So I pull up this giant PDF, took some time, and I started going through it page by page. And some of the things in that record I had seen before, such as emails back and forth with my doctor or those lab results. But the majority of it was stuff I had never seen before, specifically things like this: my notes. Doctor's notes are the most important information in our medical records. They're there to remind our doctor and other members of the healthcare team about a patient's condition and plan for treatment. But like most people, I had never seen this information before. I could Google my condition, but I never knew what my own doctors were writing about me. And seeing these notes was eye-opening. It filled me in on gaps I missed when I was unconscious from surgeries and seizures. And they let me know that my doctors were really listening to me. They were quoting me. They were saying amazing things. And there isn't a single thing in my notes I don't understand or I can't figure out. And because I've been blogging this whole time, I'm now able to compare a blog post with my clinical notes. And for every question in this blog, there is a corresponding clarification in my notes. I can't believe it took 8 years for me to have seen this information. I don't want the next 29-year-old diagnosed with a brain tumor to have to wait 8 years to see her medical record. I don't want anyone to have to wait to see the information from their doctors in their notes. So, rhetorical question for all of you. How many of you find my response surprising? Okay. Well, I don't think you should, because I believe that patients like me are being created every day. And I'm going to break this down for you. You ready? In late 2006, the internet hit 1 billion users worldwide. Then in early 2007, Apple introduced this iPhone, and it quickly became one of the world's best media players, world's best phone, and world's best way to get to the web. And then a whole group of companies emerged or transformed in and around this year. And it quickly became one of the greatest leaps forward in history, infusing everyone with a new set of capabilities to collaborate, communicate, create, and gain access to information throughout every aspect of our lives. Why does that matter? Well, 1 year later, in 2008, I became a patient. My whole healthcare experience has been colored and shaped by this new culture of easy access to information. This desire for access to information is not coming from just sick people like me. This will continue to grow as people are living longer with chronic conditions, serious illness, or begin providing care for others. I think we should make it easier for people to have access to this information. 1 year ago, I started working with the Open Notes research team at Beth Israel Deaconess Medical Center. Open Notes is a movement backed by research that is encouraging doctors and other healthcare professionals to share the notes they write with the patients they're caring for. Open Notes is not software. Open Notes is not technology. It's about increasing trust and improving patient outcomes through transparency. And research shows that when doctors and patients are on the same page, looking at the same information, a patient's level of understanding increases. Open Notes research shows that when patients who have access to and read their notes, they feel more engaged in their care. They feel like they have a better understanding of their conditions, more in control of their health, and they take medications as prescribed. 99% of patients who read their notes feel the same or better about their doctor after reading as few as one note. And care partners benefit from reading notes as much as patients themselves. They believe reading the notes helps them have more productive discussions about those they are caring for. But what about doctors? Well, doctors who share their notes say that it has little to no change on their workflow, little change on the way they actually do their documentation. They believe that sharing notes increases patient satisfaction. And no doctors have reported ever ordering more tests or referrals as a result of sharing notes. But here's what you may care about most. When patients read notes, a significant number of us find mistakes. We find errors in our list of medications, our problem lists, and our medical history. And all of this has safety implications. This is huge. Patients can find errors. Think about it. Who better to find the error in the chart than the patient? My two eyes on my one chart versus my doctor's two eyes on 1,000 charts. In 2015, the National Academies of Medicine released recommendations about partnering with patients to improve diagnosis, and they specifically recommended providing access to notes in the EHR so patients can review those notes to look for errors. Healthcare leaders like you often talk about engaging patients in safety, but how do you set that in motion? How might we create systems for patients to recognize and report errors before they lead to diagnostic failures or other problems? Having patients review the notes could put into practice those recommendations from the national academies and create a tangible, scalable strategy. And Open Notes is the first part of that strategy. It is the first step to building strong partnerships between clinicians and patients. Today, over 150 health systems are now sharing notes with patients in all 50 states. They've taken that first step. There are over 31 million patients who now have access to their notes through existing secure online patient portals. And that sounds like a lot, but it's still less than 10% of the US population. Transparency. It's logical and it's ethical in healthcare. Transparency is logical because patients need information in order to be engaged in our care. And it's ethical because information essential to patients must be disclosed, and patients must be well informed in order to make decisions. And when it comes to our health, we're forced to make decisions. I love my doctors. I get great care. But it makes me wonder even more, Why hide my notes? I think sharing should be the rule and not the exception. Our next internet search could be informed by our doctors, documented by our doctors, and shared in the form of an open note. We have the power to help ensure patient decisions are well informed, and that patients can be players in the safety of our own care. The tools are already here. We're already using them. Now let's just put doctors and patients on the same page. Thank you.